everything might not be fun.
The politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense?
We'll figure it out. This is the thing, I'm just getting totally unhinged now, and I don't know what to do.
Hi, we're in downtown Ellicott City. This is an area that was ravaged by floods a while ago and is bouncing back. And I wanted to talk about Medicare for all, because it's a big concept being discussed right now, especially among people like Bernie Sanders and his supporters. And I just want to say, from my perspective as a doctor who has written a lot about Medicare and written a lot about health reform, that I'm a big fan of any system that'll be inclusive, that will ensure as many people as possible. Look, when Medicare became law in 1965, it saved so many lives. It allowed people to have access to health care that didn't have it before. People who were going to die now had the ability to get their appendix removed, to get emergency medical care, to see a doctor, to control their blood pressure, to control their diabetes. Lots of things they couldn't do before. And it saved so many lives and gave people security. Medicaid the same way. Allowed people to have access to what I consider a universal right, which is health insurance. Everybody should be allowed to get proper medical care when they need it. The problem with Medicare is that it has morphed into something much beyond what its original intention was. And the reason was because at its inception, a dirty deal had to be made between those people who created Medicare and the medical establishment. Because there's no way this was going to get through without some support from the AMA, from the American Hospital Association, from all the forces in medicine that were fighting against it, calling it socialism, saying that it would destroy the doctor-patient relationship. Well, the great irony is the reason it did destroy the doctor-patient relationship is because of those very forces that thought it would do that. They're the ones who never wanted a doctor-patient relationship. The worst thing for the American medical system and all the people that are making billions of dollars off it is if patients actually get control of their health care. Because once patients learn the truth about which interventions work and which ones don't work, the less they're going to actually dive into the expensive healthcare system that is enriching so many people. So Medicare for All is bereft with problems because Medicare has become something that those of us who are progressive doctors who believe that patients should have choice, who believe that healthcare should give you the best health, not just the most expensive health, those of us have come to have a lot of doubt about Medicare. I love Medicare as a concept. I hate where it's gone. And I deal with Medicare every single day. So I'm not some academic who's just talking about it in theory. I live it. I see how it affects my patients, and I see how it affects my relationship with my patients. Look, I recently had a 95-year-old woman go to the hospital, really smart woman, who has atrial fibrillation, an irregular rhythm. And I had talked to her about the pros and cons of going on blood thinners. She falls a lot. Forget about it. She instantly knew she shouldn't be in it. As soon as she hit the hospital, the healthcare system pounced on her. Tests and tests and tests that were unnecessary. Mind you, she went to the hospital because she wasn't feeling well. She probably had a virus. The cardiologist got hold of her. They said, why aren't you on blood thinners? God, how come you're not on? It's a religion to them. We've talked about it. They quoted her a risk of getting a stroke if she didn't go on blood thinners of 10% a year. 10% a year. Think about that. That's not even close to being realistic, by the way. The realistic is somewhere around 0.5% a year. And the realistic possibility of her getting harmed by the blood thinner is much higher than that, which is why she's not on a blood thinner. But they had the gall to quote her that statistic. These are non-thinking doctors. They go with protocols that were given to them by people who are in a position to make a lot of money if people go on blood thinners. But they don't think about that. Doctors have become non-thinking entities. So I think back on all my patients who decided not to go on blood thinners, hundreds of them who decided not to go on blood thinners. And guess what? Not one of them's ever gotten a stroke in the 10, 15 years that I've been in practice. So when I think about that 10% a year, it just doesn't make sense because none of them get strokes. We don't see it happening. I've had a lot of people on blood thinners get strokes. I've had a lot of the people on blood thinners die from the blood thinner, but we don't talk about those things. Anyway, that's our healthcare system. Medicare enables that. Medicare enabled my patient to go to the hospital and be subjected to that abusive care. It pays well for my patient to do that. In fact, Medicare pays well for cardiologists to get stress tests and echocardiograms and carotid ultrasounds when they're not needed, for people to own their own equipment and to profit from it. For instance, a surgeon who owns their own surgical suite, you can go see them and say, I wonder if I should have this thing taken off. The surgeons are going to say, sure, you should have it taken off. And in fact, I could get it done in my own place tomorrow. That's how good a doctor I am. It encourages these doctors to self-refer for things that are unnecessary. Dermatologists cutting off stuff on people that it's not necessary. Medicare encourages people to go to the emergency room. It pays the full bill when you go to the emergency room. It doesn't pay the full bill if you need something like exercise or nutrition. If you need something like a few health aides to come to your house to help you out. It doesn't pay for that. It's a perverted system that rewards people who do procedures, who own their own equipment, who want you to be in the hospital. It rewards those people. That's Medicare. That's what it's become. Even our clinical indicators, what we're judged on, judge us if we treat people with a lot of medicine. If we give people a lot of medicine, a lot of tests, we monitor all their numbers, we pass the quality indicators. If we're more gentle with our patients, if we talk to them about the risks and benefits of things, if after that discussion they decide not to do certain things, then we are dinged by Medicare's quality indicators. We're considered non-thorough doctors. That's Medicare. Medicare is paying $1 trillion a year for what is considered useless medical care. Useless? Depends who you ask. There are a lot of people getting paid well with that $1 trillion. That $1 trillion isn't getting thrown in this river. That $1 trillion is getting put in people's pockets. And those people are feasting on Medicare. So Medicare for all, again, people like Bernie Sanders say it as though it's the equivalent of saying everybody should have good health care. But shouldn't we fix Medicare first? Shouldn't we say, let's encourage Medicare to be that insurance that gives patients actual choices, that the patients understand the actual risks and benefits, that they're not deceived by these cardiologists who quote numbers that are fed to them by pharmaceutical company studies that the cardiologists don't even understand. We don't need that. We need patients to get actual numbers. What are the risks and benefits of lowering your blood pressure a certain amount? What are the risks and benefits of going on statins? What are the risks and benefits of getting this mole removed from my arm or getting a stress test every year? And once they know that, they may find that they're not on as many medicines. They don't go to the hospital as much. They don't get all these tests. They may decide they don't want to do that because they may see the benefit is really tiny, or they may decide to do it. But the bottom line is Medicare doesn't give them that choice, and Medicare rewards doctors who simply push things on them right now. So before we start talking about Medicare for all and thinking we're being these wonderful people who want to help everyone, let's take a step back and say, how about if we fix Medicare so it's more patient-centric, i.e. it serves the patients and not the doctors, and make it so it enables good communication between doctor and patient, and it actually encourages sensible health care. It pays for things it doesn't pay for now, such as home care and exercise, and it'll still pay for that other stuff, like if you want to get moles removed, but it won't pay as much. Pay the doctors less for that stuff, and guess what? You'll miraculously see it's not occurring as much. You know, stop paying radiologists to do all these CAT scans, and then they'll stop encouraging patients to get all these CAT scans. It's really simple. Common sense seems to be lacking. So let's fix Medicare and then maybe Medicare for all. But for now, I think all we got to do is try to come up with an alternative healthcare system, some other insurance company that actually promotes sensible healthcare, that hopefully people like Atul Gawande are working on right now. And then maybe once that occurs, that could be for all. And we can have a healthcare system we're proud of that has good outcomes at a low cost. And yeah, a lot of people aren't going to be rich, but they'll do just fine. I'm not worried about it. Anyway, Ellicott City, take care. Hey, hope you like the podcast. We'll be back next week. I'm going to give you some information. If you want to check the website, if you want to email me, if you got your own stories, let's talk about it. See you next week.